Let us look at what is the definition of syncope. The definition of syncope is spontaneous loss of consciousness associated with loss of postural tone, which is of short duration with spontaneous recovery without any residual neurological deficit. And this usually results from decreased cerebral perfusion. This can also be described as mentioned earlier as a blackout or a collapse. Some people can just collapse without loss of consciousness and can recover spontaneously. Sometimes the syncope may be associated with a prodrome or a warning features, which may include lightheadedness, nausea, diaphoresis sweating, visual disturbance in the form of transient obscurations or transient blurred vision, and this may occur for a few seconds to a few minutes before the event. In a cardiac syncope, usually there is not much of a prodrome. Pre-syncope is the presence of prodromal symptoms without the loss of consciousness. That is, the prodromal symptoms alone occur, the patient does not become unconscious, and this is because the hemodynamic event was self-limited and corrected. This convulsive syncope is a term which has been used only in the last probably 2 decades. It was observed in the football players when they had a transient concussion followed by few jerks. This is loss of consciousness followed by transient insufficiency of blood supply to the brain, and this can occasionally associated with the jerks or posturing generally involving the limbs. This is known as a convulsive syncope. Near syncope and syncope both are thought to be related to the decreased perfusion of the brain, and any disease which decreases the blood supply can therefore produce syncope or a near syncope. This will have to be differentiated from what is known as a pseudo syncope or psychogenic non-epileptic events or seizures. Pseudo syncope mimics a syncope, but here the patient does not have total loss of consciousness. They may be aware of the event and it's usually associated with some intense stressful situation. A psychogenic attack characterized by loss of muscle tone, having the appearance of faint but may not have total LOC, is known as pseudo syncope. The psychogenic non-epileptic event, in contrast to pseudo syncope, may have some episodes in which there is an altered movement or sensation or experience similar to epilepsy, but is caused by a psychological process and is not associated with any abnormal discharges in the brain. That's a EEG. EEG is usually normal even during the event. So we have to differentiate syncope from pseudo syncope and psychogenic non-epileptic attack.